Welcome to Living Chassidus. Together, let's live the Chassidus we learn. Okay, welcome everybody. Here we are yet again at Living Chassidus for our life skills series. Today, we have the great zchus of having Irit Lang. She is a doula, and she's been part of the birthing community in New York for 15 years. I recently heard about this from other midwives. So I was gathering midwives to come speak, and they said, "What do you mean?" Irit is the founder of Birth Doulas International, which trains and certifies labor and birth doulas. And in addition to all of these incredible things that she does, she also works with kidney transplant. So she does chesed in so many levels. And I think the best part of it all is that she's been my favorite neighbor. Don't tell anybody else. She's been my favorite neighbor for the past 9 years that we've been living almost together. So thank you so much, Irit, for sharing all of your wisdom with us, and we can't wait to hear more.
Michal, thank you for the introduction. I really appreciate that. It's great to have you as a neighbor too, really. I know there's some other people from our building on here, so I won't pick favorites, but great to have you as a neighbor. It's been really a pleasure. And thank you for inviting me to speak to your Living Chassidus group. You do awesome work in the community. I wish you continued success and only much atzlacha. Okay, so as Michal said, I've been a doula for 15 years. I have mainly worked with the Ukrainian community, sometimes Bar Park, Williamsburg also, but mainly doing births in the New York area. So some of the information I'm going to share tonight touches on what to look for when hiring a doula, what a doula does, how a doula can help you prepare for birth, some little tips about what birth is about, and then how to choose a hospital and a provider. I will go through all the main centers in New York and what the pros and cons to each center is to help you pick the right center for you. And then after that, we'll open it to questions. If anybody wants to send Michal some questions while I am talking, I will happily answer as many as I can afterwards. Okay, I'm going to share my screen. Okay, you can see it? It's clear? Okay. Okay, so one of the most important things when hiring a doula is you're looking for somebody who is going to give you the attention you deserve. So the things that a doula will do for you and help you throughout your labor takes a lot of listening skills. And these are some of the key things that a doula will do. First, pay attention to your needs, the things that you want, withhold any judgment from what's going on and the situation at hand to be able to best guide you through the situation. Reflective listening, clarify things for you, summarize, and share information. These are the most important things that a doula can do for somebody while she is in labor. Remember, most doulas have a lot of experience. They're there to share this information with you and help you through this process. This is a birth, your birth, not their experience. They are here to be an advocate for you. Pay attention to the details and things that you want out of your own birth. Listen to what you have to say and help you get that by clarifying things, summarizing things, or even speaking up on your behalf. So when meeting a doula, you want to know that the person that you're hiring is able to do these things for you. This is something that I do with my clients when I meet with them. I forward my doula client intake form, and some of it is some very basic information, like your legal name, your contact phone numbers, your spouse's contact information, and the date of your due date, your what number pregnancy, which hospital. But then the last part of it is a lot of all your birth preferences. Something like this for you to put together, or for your doula to give you to put together, is super important. That way the doula is able to focus on your needs during labor, not only during labor, before labor, after labor. For example, as you can see on this, some of the things that I put on here are making a birth plan, knowing about your fears and concerns and things that you want for birth, knowing that that your partner's role, what childcare options you have. I know some of these things seem like little things, but when push comes to shove and you're in labor and you want to be able to get the attention that you need to get through your labor and have the support that you need to get through labor, having a document that has all these things jotted down that's easy access makes a very, very big difference to people. A contract is something that's really good to have, just so that it's very, very clear as to what is expected from your doula and what is expected from you on what you can get. Laying out all the hours, the amounts of money, it just makes everything clear and concise. The next thing that I highly recommend people do, this is a triage form. When you get to triage, I'm going to talk about hospital births for a little bit. When a person is in labor and they labor at home as long as they want, and then they eventually do go to the hospital, they have to go through triage. Triage is a place where you kind of register. They kind of register you and they figure out where you're holding in your labor and then decide what the next step for you will be. Now, most people who want to stay out of the hospital as long as possible land up going to triage in very, very active labor. The stages of labor we'll get to in a moment, but they land up going to the hospital in very active labor. And then you get to triage and all of a sudden the nurse has 1,000,001 questions for you. When was your last period? What medications are you on? Did you take this? Do you have this? What's your GBS status? A list of questions. So this is a form that I give out to people. And if anybody wants copies of it, I'm happy to share it. I created it for Birth Doulas International. It's a form that you can fill out in your home when things are calm and quiet beforehand and take it to the hospital with you, already prepared, and hand it to the nurse so you don't have to worry about answering all those questions. Obviously, when you're dealing with a home birth, you're lucky you don't have to deal with these things. Most of the things the home birth midwife knows, and you don't have to go through them. The next thing that a doula helps with is creating a birth plan. A birth plan is super important. It helps the hospital staff as well as your spouse and your doula and everybody know what your preferences are for your labor. Everybody has different preferences. For some people, it's to stay out of the hospital as long as possible. For some people, it's that they want music on and the room dim and quiet. Everybody has different things. This is just another example of listing your birth preferences. These are different things that you can do, that you can list with your doula to ensure that you get the birth that you want. Now, obviously, we don't really know what's going to happen and how the birth will play out, but this at least gives you your preferences written down, clear and concise. Towards the end of this, we're going to go through the different hospitals and what's realistic for each different hospital, which is something that you need to consider when making a birth plan. For example, if you decide that you want to labor in the tub and you want to give birth in a tub and you're delivering in a hospital that either doesn't have tubs or doesn't allow somebody to labor or birth in the tub, then you can't list that on your birth plan or on your list of preferences. So this is another part where the doula can come into play. The doula knows what goes on in that hospital, what's usual with the practice that you're using so that your birth plan can be realistic. For some people, I know I get calls for a lot of people who are just in early pregnancy trying to find the right doctor. And I always tell people there isn't one doctor or one hospital for everybody. It really depends on your birth preferences and what you want from your labor. Some people want only female providers. Some people want hospitals that are close by. Some people want sole practitioners and not a group of 10 different people that they're seeing. Everybody is different. There's no one right hospital or one right practice for everybody. So these are all important things to discuss. And I find in our community, especially when people are newly pregnant and they don't really have who to turn to, they don't know where to start, they don't know where to go. A doula is a resource where you could speak to somebody and you could ask, this is what I want for my birth. Where would you suggest I give birth? Which practice will allow me to do these types of things? And then all those things can be put down onto your birth plan. These are some of the things that statistics prove and research proves that a patient benefits from having doula care. There's a huge drop in medication. Doulas enable moms to stay home as longer than possible. Having that extra support at home enables somebody to labor at home feeling safe and secure versus running to the hospital early. In the case of a home birth, it doesn't serve as running to the hospital, but it serves in that sense of security at home, at being at home with somebody who you feel secure with, and the home birth midwife not having to run there, and just knowing that somebody's there. Sometimes I get to patients when they're in labor and they're fine. Like I get to the house and they're doing really well. They're managing through the contractions really well, using whatever their coping mechanism is. And sometimes I think to myself, like, I'm not really doing much. I'm just sitting here holding their hand because they're doing their thing. And then most often than not, they turn to me and they say to me, just by you being here, I feel safer. Just sometimes just knowing that you have somebody there makes all the difference. But statistics prove that there are definitely less negative experiences. Labors are shorter when you have better support. There's a huge drop in C-sections, many more vaginal births, higher APGARs, and much more breastfeeding support when you have doulas. Over COVID, I actually worked in Methodist Hospital when the governor kind of put a ban on support staff for the hospital. There were 5 days in New York City where the governor said that no patients in labor were allowed any support staff. Methodist Hospital actually quite impressively, instead of just kicking all family out, they actually hired doulas on staff to be there to support families, to support laboring women. Thank God there were only 5 days in New York City that there was no support allowed. After that, the governor only said one person. So people were left to choose between husband and doula. And that's where a lot of the doulas at Methodist landed up filling that void, where people were able to bring their spouse. And then when we were able to move around the floor and help people in a doula capacity. It's a little bit different to hiring somebody privately. You don't get all that benefit of meeting them before and creating a relationship and learning about the patient's birth preferences beforehand, but it was better than having nothing and only having to choose between spouse and doula. But one thing that Methodist even noticed is that over the time of COVID, bearing in mind everybody was worrying about all the people who were sick, their numbers of breastfeeding patients skyrocketed while the doulas were there, because when we weren't in labor and delivery, we were helping mothers, supporting mothers through breastfeeding. And there were many, many, many women who never thought that they could breastfeed or never thought that it was even an option for them, who landed up breastfeeding. And it really, really makes a difference. Having that extra support, having somebody to turn to makes all the difference in having a smoother, better experience. Just to outline the basics, doulas offer emotional support. They educate the family, physical support. They advocate for the patients and give resources. Technically, a doula is not allowed to provide any medical advice, not able to do any medical procedures. But it's the type of thing where the doctor says, I want to give this medication or I want to do this procedure. And then you turn to the doula, should I do this? Is this something that I should be doing? The doula can lay out the pros and cons for each situation and help you make a decision. Turn to you and your husband and kind of figure out what's best for you in that situation. Very often, especially in New York City, I think that this is very different out of town, and it's also different for home births, is that the doctor's offices are very busy. You're in and out, the appointments are quick. You're not getting all the attention that you deserve from your provider until you're actually in labor. So sometimes having that doula to run things by, to talk to spend a few extra minutes on the phone with makes a very big difference. Here is just some.
Sorry, 1 second. We're hearing like a little bit of a ringing noise. So I'm gonna mute you for a second and then you'll unmute yourself and let's see if that takes it. There we go. Sorry. It's still ringing for some reason.
You want me to switch to my phone?
Is that maybe either that or do you have headphones? I wonder if that would.
I do not have. I have a headset for my phone, but I don't have a headset for the computer.
Okay.
Do you have?
Let me presume. Okay, we're back. Baruch Hashem.
Okay, so just a little bit of anatomy. Okay, this is the fetus inside the inside the uterus. Okay, this here, this is the uterus muscle, which is around the fetus. This fluid here, this is the amniotic sac. This is where the fluid kind of collects. This is the cervix on the bottom over here, which is closed right now. This is the bladder, this is the vagina, and this is the anus. So this is the front of the belly. This is the belly, and this is the back. This is the umbilical cord here, and this is the placenta. So during labor, what has to happen is that this cervix has to thin out and become very, very thin. The easiest way to describe it is if you were looking at a cervix, it looks almost like a puffy round donut with a tiny little hole in the middle. That donut has to thin out and that hole has to stretch. So it goes from, say, a puffy donut to a stretchy rubber band. And that kind of stretches over the baby's head over here. That kind of stretches, makes it wide enough for the baby's head to fit through. So those are two things that are happening to the cervix. One is dilation, which is this is the cervical dilation chart. So 1 centimeter is the size of about a Cheerio, 2 is the size of a grape, 3 is the size of a slice of banana, etc., etc. Your cervix has to go from 1 centimeter to 10 centimeters, which is about the size of a cantaloupe. So this is that area. That's the first thing that has to happen to the cervix. The cervix the hole has to widen in order for the baby to come out. So that's the first, the dilation. That's the first thing it has to do. The second thing it has to do is it has to thin out. Look here how the cervix is very long and thick. And here it's a little bit shorter and a little bit shorter and a little bit shorter. And look, this is only 3 centimeters dilated, but it's much, much, much thinner cervix. This is already thinner. You see where the cervix has already gone dissipated and already on the sides of the baby's head. So basically, this cervix will open and shorten. So all this tissue will land up being right over here and leave room for the baby's head to come out. When somebody starts to push to deliver the baby kind of comes down under the pubic bone, which is here. How do I move this? 1 second. Under the pubic bone, which is here, and then out. Okay, this is the last thing that has to happen in the stages of labor, which is basically the station. So again, over here, this is with the two things that are happening to the cervix is it's dilating and it is effacing. It's thinning and it's shortening. And then it has to come lower and lower and lower. So when the baby's up in the uterus over here, the baby's at, like, say, a -5. And then the baby kind of gets lower and lower and lower and lower and lower in labor. When the baby's head reaches the ischial spine, the baby is known to be at what's called 0 station, which is where you want to be when you start pushing to deliver a baby. That's where it's a good sign that the baby's on the way out. Anything +1, +2, +3 is when you're considered crowning and the baby is coming down. So when somebody's in labor, the 3 things that they will share, the 3 numbers that they will share with you to see how your labor is going are the effacement, the station, and the dilation. This is a very cute short video that I'm just going to show everybody so you can get in a little bit of an idea of what it means to efface and dilate. I hope it's going to work. Let's see. I just want to make sure. Can you guys hear it? Is it clear? Make it bigger. Click to enlarge.
Balloon exercise.
There we go.
This was something that I got from a fantastic workshop called Stomp Out Boring Childbirth Classes. If you ever have a chance to attend that workshop, it's fantastic. So
I don't think they can hear.
How do you know? You want to go to chat?
Okay.
First part is
We
when you
can
put
hear.
the ball in the balloon. And if you just put it in, if you just try and open it a little bit and put the ball in, it's going to get stuck. And as I always said in class, stuck is a word we don't like to have associated with childbirth. So what you have to do is get your fingers all the way to the very bottom of the balloon and crank it way open and then poke the ball in. And then you have that. So then we've got that ping pong ball in there and we're going to inflate it about halfway. About like that. And then you can let that ping pong ball settle into the neck of the balloon. Sometimes giving the neck a little tug really helps. And then you can let go of it and it'll stay inflated. And I show people how if you just squeeze the side of the balloon like this, not much is happening to the neck of the balloon here, and it's not opening very much. These are the Braxton Hicks contractions that are just practice contractions that are more and more common towards the end of pregnancy, but they don't do all that much to what's happening to the cervix. So real contractions happen at the top of the uterus. That's where the power of contractions happens. It's the muscle fibers at the top here getting shorter and thicker, which squeeze the top and then pull up on the side of the uterus here. And just like with real contractions, I have everybody just squeeze and then let go, and then just squeeze and let go. You just have to do a little bit at a time. And you can see how we're getting that effacement or thinning of the cervix down here. And not much dilation is happening while we're still working on shortening the cervix here. And this is a lot of the work that's going on in early labor. It's mostly about that shortening and less about the dilation. So once we get to much more effaced, much more thin, then we're going to start dilating the cervix there. And a lot of people get kind of nervous at this point. It's like, oh no, it's, you know, I don't want to push. So we always have a bit of a joke. It's just like actual labor where you'd be like, it's okay, just breathe, do it gently. You're stretching beautifully. And then just give it one more push and the baby will be here. There you go.
Okay, how do we go back? Next slide. No. How do we go back to the slideshow? Click the exit full screen. Oh, there we go. There. Okay, so just to give you a little bit, in very short, a recap of what the stages of labors are and what somebody is experiencing. This is the first stage of this is what's called stage 1, which is labor. There's 3 stages to that. There is what's called early labor. This is when the contractions are mild. They're there, but they're not as strong as they need to be. These are the kind of waves that somebody experiences. As you can see, the cervix is still kind of thick and not open very much. And usually women are managing through that. Where is everybody? Where are all the people?
Oh, on the side. Yes. If you want them back. There you go.
Helps to talk to somebody.
You don't want to talk to yourself?
It kind of gives you a little bit of an idea of where this is, where somebody's holding at this frame of mind. You know, they're able to manage through the contractions, maybe even sleep through them, sleep through in between them, or even during them, depending on, you know, how severe they are. The active labor stage, as you can see, the contractions get a lot bigger. They're more intense. They get a lot bigger. You can see how the cervix is starting to thin and starting to open a lot more. And usually people are not so happy anymore. You could see the demeanor in people starting to change and things starting to get more serious. The third stage is called transition, where the contractions really get really intense. The early stage of labor is usually 0 to 5, 0 to 6 centimeters. The active stage of labor is usually 6 to 8 centimeters, and transition, where the contractions get really strong and sometimes even have multiple peaks, is usually 8 to 10 centimeters. And that is usually a time that is very intense. And then the
the next part of it, the next part of birth is the actual pushing stage, delivery of a baby and the placenta. And that's usually 10 centimeters to delivery. And the contractions then are more burny, more painful in that sense. Not so much spikes, but just like more intense, staying at that intense stage. And usually that ends in the happiest part of all of this experience. So just a small graphic to give you a little bit of an idea of what we're dealing with. Now, when anybody's in pain, whether you're dealing with a sore hand, a sore finger, or even a headache, we always find things that help us through them, whether it's somebody who goes for the Tylenol for a headache, or somebody who goes into a dark room and decides to lie down, or go get a neck massage. In life, we're used to turning and looking for things that comfort us, that make us feel better, that make us feel safe, that make us feel secure. When somebody is going through these different stages of labor, we need to feel safe, secure, supported. And these are some of the things that will help us do that. Hiring a doula, knowing the hospital that you're in and your provider that you choose are the right ones for you, knowing your preferences, knowing what's good, knowing what you want will make the process a lot better. Why doesn't it? Okay. This is something that I give to all of my clients. It's called Penny Simpkins' Roadmap of Labor. And it just gives you a little bit of an idea of the different things that you can do during labor to help support you. You know, things that you do, like it starts off like when early labor, you'll do a lot of resting, checking in with your doula, checking in with your doctor, staying at home, a little bit of massage, kind of hanging out on, you know, dancing, sitting on the birth ball. And then there's the kind of two different paths that you take. Do you kind of like take one path where you've got like a lot of back labor, what you're going to do? Do you take this different path where things are going really well and you're still being supported? Or is there like, okay, we need to go to the hospital path and like this is the route that we take? So this is just something that is very helpful. There's a lot of things along the way, diagrams and pictures for you to see all the different types of birth, whether it's a home birth, whether it's a hospital birth, all the different options out there and things to do along the way. But with labor, the most important thing for women to know is that we need to plan, but we also need to let go. We need to know our information. We need to have resources at hand. We need to have good support. But at the same time, birth could take any route. There's no way to know which route birth is going to take. And the most important thing is to have that information so you can make decisions in the moment, feel supported in the moment, and feel like you can get through it, that you have the support you need to get through what's coming your way. Fear, tension, pain there is this a fear, tension, pain cycle which goes on and on and on during labor. It's something that could start, that comes either from fight or flight, stress and anxiety of a birth. It can go into tension, whether it's in your legs, in your pelvic floor, even in your jaw, and then can cause fatigue. And then that decreases oxygen to the uterus, and that increases lactic acid, which increases pain. And the fear cycle just continues. By using different things to support ourselves through this time that we know has fear and pain associated with us, we do much better. The results are better, the outcomes are better, moms are happier, moms feel safer. And a lot of these things, hiring a doula and the right support, are things that can help you through that. One other thing I want to touch on before I go into hospitals is affirmations. This is one of the affirmations that I give to a lot of my clients for people to use, different things that you can use. It's very important for you to find something that works for you, that helps center you, calm you, relax you, and brings you to a place of feeling confident, supported, and a lot of trust with the people that are around you. So these are some ideas that I give to my clients to use, but you can make your own. And it's just important to have what you need at that time. Anytime anybody goes through something that's stressful or changing or painful, we want as much support as possible. And this gives us a little bit of things as something extra to help us. As you see, some of these things are reminders. Some of these things are expressions, different things that people could use. Okay, the next thing we're going to touch on is talking about postpartum.
but before I get there, um, one thing that I've seen a lot is that people, especially in today's day and age, especially with COVID, people do not want to take classes. People do not want to have the information at hand. As a matter of fact, I feel like a lot of people live in this little bubble and they're like, no, I just want a natural childbirth and I'm going to walk into the hospital and everything's going to be fine. Or, yeah, I hired a home birth midwife and I hired a doula and my baby's just going to come. Unfortunately, life is not like that. We need to educate ourselves, just like you do research before you buy a stroller, whether that research is Consumer Reports or online forums or your 10 best friends. It's important to take classes and prepare yourself for labor so you know what to expect. Just as the same thing, it's important to prepare yourself for postpartum so that you can be supported and feel as secure as you can postpartum. When we take childbirth classes, we're educating ourselves about birth, labor, and birth so that we know what to expect and we can plan as best we can. Because you really don't know what you're like. Most moms, when they're coming to having their second, third, fourth kids, they know a little bit about what they want from their labors. They know what worked for the first, what didn't work for the first, what they want to change from the first, what they don't want to change from the first. So that gives you a little bit of information to kind of plan. But before your first, you don't have that information. The only way to get it is from a class, is from educating yourself. Knowledge is power in this situation, even if it's the knowledge to be able to make decisions in the moment, knowing what the doctor's offering you, knowing the risks about it. And the same comes with postpartum. Just like I make birth plans with my clients, I make a postpartum plan. And for some people, the postpartum plan is that I have a freezer and I'm going to stock it up with 6 weeks worth of food. And for some people, it's that their mother's going to come. And for some people, they're going to go to a Kimpaturin home. Everybody is different, but it's so important for you to make a postpartum plan for a few reasons. A, you don't know how you're going to be after you have your first baby. You might feel amazing. You might feel like you need 2 weeks in bed. This gives you a little bit of a plan. And as you'll read through the plan here, you'll see that some of the information on this postpartum plan is basic information, like the phone number to your pharmacy and the phone number to your pediatrician for your baby, especially when you're a first-time mom. Most third, fourth, fifth-time moms know the pediatrician's number off by heart, but first-time moms do not. Most third, fourth, and fifth babies, the mothers know the pharmacy's number off by heart, but first-time mothers do not. Having everything written in one place that can be listed on the fridge so that if your mother, your neighbor, or your husband needs to make that call for you to the pediatrician or to the pharmacy, having that information at hand and listed, easily accessible, is helpful. And then having your postpartum plan listed. Who's going to be your childcare support if you need? Who's your cleaning help if you need? Who is your shopping support if you need? Maybe you're a whiz at making online orders at the marketplace. But if you're having a bad day or you're feeling down and you need a day just to relax and it's Thursday and you need to order, who's going to be that person that you can pick up the phone to and say, please, I need help with shopping? It is so important to make a postpartum plan, especially for your first baby, until you know what you're like postpartum, until you know how you recover from birth. It's important to have all these things in place.
I say the amen like a million times.
Okay.
Before we jump into New York,
yeah,
there were some out-of-town members. One of them asked, do you have any suggestions for how to get through back labor?
With back labor. So back labor is difficult labor, and
Let me explain what that is.
I'm gonna explain it. Okay. Sometimes when you're in labor, most of the time the contractions are up here, this part of the uterus, the top of the belly, and then sometimes lower. As we saw in the video, the kind of contractions kind of pull the sides of the uterus up and then you contract here. But sometimes women will feel the labor in their back more than in their front. Very often it comes from the position of the baby. Sometimes if the baby's head, the back of the head is this way, is facing the back, where it's more bone on bone, versus here it's kind of like the baby's face on the bone versus the baby's backbone on the towards the mother's backbone. When that happens, that causes something called back labor, where you feel most of the contractions actually in your back kind of like really like right above your tush, actually. That's where kind of where you'll feel the pain. So back labor is more difficult than regular labor. It is very painful. And the thing that helps the most with back labor is actually water. Getting into the shower and, using even one of the handheld showers and aiming it straight towards your back and feeling that pressure and that heat on your back. Laying in a tub takes the pressure off the back. That's extremely helpful. If you're not able to do a shower or a tub, heat is very helpful. Obviously, if you can't use heat if you have an epidural placed, but if you don't have an epidural placed, heat is good. The other thing that is extremely, extremely helpful, and I'm not sure why it's not used as much, it's something called a TENS machine. I don't know if anybody's ever gone for any PT, and sometimes they put these like little sticky pads on you and they connect it to like a little like vibrator almost, and it sends like pulsating like pulses into your body. Putting that on your back and using that is very, very, very helpful for back labor. They're not expensive to buy. You can buy them on Amazon for $20, $25 a piece. And I have found them to be extremely, extremely helpful, especially for back labor. The other time I use the TENS machine a lot is for people who either are not able to medically or choose not to have an epidural. So in home births, they're used a lot. And then for people in the hospital who have like, say, a spinal issue and have a rod in their back or something like that, where they can't get an epidural, they use the TENS machine for pain relief. And it's very, 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 very helpful. Okay, any other questions to address before we,
Someone mentioned spinningbabies.com is amazing for preventing back labor. What are your thoughts on that?
Spinning Babies is great, but Spinning Babies is a class in its own. Spinning Babies is incredible. You can look it up, spinningbabies.com. They have these exercises called the Three Sisters that is highly recommended to do during pregnancy, towards the end of pregnancy, and it does help position the baby correctly. In general, when centuries ago, when women were working out in the fields and bending and moving around, pelvises had room for babies to kind of get into the right position. The life that we lead in the modern day world does not allow for that as much. So if your birth and your birth process is super important to you, I highly recommend doing something other than your daily routine. Finding an exercise routine that's good for you, whether it's like a prenatal yoga or even just walking every day. Turning to either a chiropractor or a acupuncturist or somebody to help you get through the stages of labor, prepare your body for labor, to get that pelvis ready to support this baby coming into the world. It can only make the process better. And I feel like in today's day and age, when all we do is sit around on computers, especially in a time like COVID, and we're not walking outside and doing as much as we should be, it's even more important than to, kind of do these extra things to help your labor.
There was a question about, are hospitals these days okay using with the TENS?
You mean if you bring your own?
Yeah.
Yeah, if you bring your own. If you bring your own TENS machine to the hospital, they are okay if you use it. I've done it many, many times. They are not a fan of it. If you have an epidural placed, they don't want it, which is most likely not needed when you have an epidural placed. And sometimes I've seen when if baby's heart rate is having a hard time, sometimes they would say, we need to kind of track the baby's heart rate. Sometimes the pulsating interferes with the tracing that they're able to pick up of the fetal heart rate. So sometimes they'll tell you, can we do 1 off, 1 on, 1 off, 1 on, or 2 on, 2 off? This way, give it a little bit of time. But it's not very common that they make you stop using it. I've only seen that happen once or twice.
Another question is, what's your opinion on One Strong Mama exercises for helping baby get into the good position?
She's great, One Strong Mama. Highly recommend them.
Okay, I think we're
Good. Okay, so we're going to move on. We're going to talk a little bit about the hospitals. I am going to preface this part of the talk with the fact that we are living in COVID times, and things are changing every day. There are some hospitals that are stricter during COVID, some hospitals that are less strict during COVID, and again, even what's going on today in one hospital might not be what's going on in tomorrow's in that hospital. So the best thing is, if you are delivering in a hospital, that you need to regularly check with your provider towards the end of pregnancy what is allowed and what is not allowed. So I'm just going to go through the hospitals one at a time, and if anybody has any questions afterwards, we could do. I'm going to start with the most commonly hospitals used closer to the Crown Heights community, and then we'll move out to other ones. So Maimonides, one of the great things about Maimonides is a lot of from doctor options. They allow 2 people in triage. There's early dismissal, which is optional. So most hospitals give you 48 hours in the hospital. Some mothers want to leave earlier, so they have that option. Unfortunately, triage, there is a long wait in Maimonides. There is a lot of women there. It's a very busy hospital, and there is a long wait there. Brooklyn, there's a lot of Brooklyn doctors' offices. It's close proximity to Crown Heights. It's a baby-friendly hospital. There's a lot of midwives there, which is great. The Borough Park midwives is a big group there that are fantastic midwives. They accept Medicaid, which is great for a lot of people in our community. Their NICU is a regional perinatal center, which is a great center, and they have a pretty low C-section rate of 25.50%. Unfortunately, with COVID, they are requiring doulas to have a certification. Doulas must sign in, and they're only allowing 1 support person besides doula. So that's say dad and doula are allowed. For people who want to be near the frum community, it's a great option. But the downside to Maimonides is that it's a little bit like a factory. There's a lot of people coming in and a lot of people going out. So you really have to take that into consideration.
Can I, so we have other classes about midwives and doctors, but just in case anybody hasn't seen our other classes about midwives and doctors, do you have like a short something about the difference?
Sure. So, okay, so midwives are trained more in birth. They're trained in female anatomy. They're trained in birth, which is what they focus in. The big difference in the training of them towards doctors is that doctors are trained as surgeons as well as doctors. As far as care goes for the woman, midwives are usually nurses before they become a midwife. So they're much more used to giving one-on-one care. They're much more hands-on than doctors are. The big difference in the care goes is when it comes to birth, they can all do the same thing. A regular vaginal delivery, they can all do the same thing, doctors and midwives. When it comes to procedures, that is the big difference. So smaller procedures that can be done in the office, like for example, inserting an IUD or going for a regular annual visit or anything like that, can be done by a midwife or a doctor, but any surgical procedures need to be done by a doctor. So that's the big difference between the two.
Is there a difference in treatment?
So the midwives are much more hands-on than the doctors. Doctors are more hands-off. Midwives are much more hands-on. You'll never find a doctor who'll sit next to the patient's bed and labor with them, but the midwives will do that. Okay, I hope that answers your questions.
Yeah.
Methodist, they generally don't have an early discharge option, but now during COVID they do. And that's something that they might stick with. I've been hearing things about that. So that's a good thing. Only 1 person is allowed in triage. Sometimes triage can have a long wait. There's local doctors' offices. It's close proximity to Crown Heights. It's a baby-friendly option. Lots of midwives there. They accept Medicaid. It's a level 3 NICU, and they have a C-section rate of about 33%. Doulas are allowed. 1 support person is allowed besides the doula. They're very doula-friendly there. The nurses in general on the labor and delivery floor are friendly, they're ready to help and support women through labor. And they're probably the best center in Brooklyn to give birth. Okay, let me just move this. Which one is this? Okay, I'm gonna do Staten Island first, then we'll go to NYU Manhattan. Staten Island. Sure.
Thank you. I was wondering if you could share your, have you assisted moms at home births? And I was wondering if you would want to share your experience of helping moms in a home versus helping moms at the hospital.
Sure. I'm going to talk about that afterwards. We're just going to go through all the different hospital centers, and then we're going to go into home births.
So thank you.
Okay. All right. Staten Island Hospital is from doctor's options. They only allow one person in triage. They have an early discharge option. Usually there's a short wait in triage. Unfortunately, due to COVID, there's a typo there, I'm sorry. Unfortunately, due to COVID, the triage is a little bit different. I'll go through that in a second. It's considered a decent proximity to Crown Heights. There are hospitals that are a lot further. It's baby-friendly hospital. There are no midwife options. There are Medicaid providers. They have a level 3 NICU, and they have a 20% C-section rate. They have one of the lowest rates in New York City, which is quite incredible of that hospital. They do allow doulas, but doulas have to be certified with the hospital. So basically what they're requiring these days during COVID is that doulas need to send in their certification and an ID prior to coming to the hospital. They need to kind of be approved. So the hospital's kind of investigating to check their certification. And then they get an approval letter from the hospital saying that they can come to the hospital. So doulas need to take that into consideration when going to that hospital. Only one support person is allowed besides the doula. With triage, the one thing that they are doing now, and that's due to COVID, because the numbers in Staten Island are very high at the moment, and they're actually one of the busiest centers around, so they are being super, super strict. When a person goes to the hospital at the moment, and again, this might change next week, the patient has to go to labor and delivery by themselves into triage, and only once the patient has been admitted to a room is the doula and the husband allowed to join them. And unfortunately, I've seen that take anywhere from 1 hour to 5 hours, depending on what's going on.
There's a question.
Yeah.
In regards to this one, level 3 NICU. What does that mean?
There's a few different levels of NICUs. There's a level 1, level 2, level 3. Level 3 is the highest one that we have. And so, it's, I mean, I'm not going to go into all the details of the difference, but it's, okay, so let's put it this way. There's basically there's 1, 2, and 3, and then there's specialized hospitals. So specialized hospitals, I will get to them in a minute, are Cornell and Columbia, which have special children's hospitals for acute care and real things that we don't want to talk about, things that are drastic things that happen to babies where they need care. The level below that is level 3. So besides the acute care, level 3 is the highest level that you get. And that is the highest level NICU if the baby needs. Means that there's more pediatricians, there's more support for baby if something goes wrong. There's pediatricians available for the deliveries, and they're all there. In a lot of hospitals, they send in a baby nurse, not a pediatrician for the delivery. Sometimes it depends on the center. Some centers have a baby nurse at every delivery. Some centers have a pediatrician at every delivery. Some centers only call a pediatrician if they need the pediatrician. But ideally, if you are delivering in a hospital because you want to, know that there's extra NICU care for your baby, you want a level 3 or higher. If you have a baby that Chas v'Shalom has something very wrong with it, I'm sure your provider will move you along to one of the better hospitals like Cornell or Columbia, where they specialize in baby care, which we will get to in a moment.
And then there was one question. What are the differences, just to clarify, between doulas and midwives?
Sure. So midwives almost function as a doctor. They're your provider for your pregnancy. So you see them for your regular visits throughout your pregnancy. You see them once a week towards the end of your pregnancy. They're there to deliver your baby and give you postpartum care. They will be there to, you know, do anything that needs to happen during labor, deliver your baby, stitches if needed, or whatever needs to be done. Doulas are there to give you emotional and physical support for labor and birth. Yes, you could meet your doula beforehand, you could spend time with them on the phone, you could do all those kinds of things, but they're not your doctor, they're not your provider, they're there as your support. They're there to support you physically and emotionally for that, help educate you, advocate for you if necessary. I think that makes it clearer.
Yes. And don't C-section rates have more to do with which practice you use rather than hospital?
Yes and no. There definitely are some practices that have lower C-section rates than others. But generally overall, there's kind of like a philosophy that kind of goes on at a hospital on a labor floor. And, you know, I even know that when some residents interview for positions at certain hospitals, they're told, you know, this hospital is very, you know, natural birth friendly, or we have a very high C-section rate. Is that in line with what you want? Or we're very supportive of natural childbirth here. We don't push anything on our patients, you know? So that kind of depends on the hospital also, and the team that's leading the labor and delivery unit. There definitely are some C-sections that are necessary. There are some repeat C-sections that are necessary. There are some people who choose C-section as a first choice, and that's their prerogative. Each person has to make that choice for themselves. As I said before, there is no one way to labor and birth. Everybody needs a different doctor, different hospital. Everybody needs something different. I'll give you an example. I was at a birth a little over a year ago of a woman who, you know, her and her husband were married for 15 years, and this was their first kid. They went for years and years and years of infertility, and she decided that she didn't want to labor. She wanted to have a C-section. And she got a lot of flack from a lot of people, but at the end of the day, it was her and her husband's decision, and that's what they chose. And when they hired me as a doula, it's not my place to turn around to them and say to them, you know, I don't think you should do this. I'm there to support them in their choice, in whatever they have chosen to do for that labor, for that birth. Okay. NYU Manhattan, the nursing staff are incredible there. They're really, really above average. NYU's nursing staff have actually won a lot of awards for their care. They have the specialized baby care that I was talking about. They have an excellent postpartum depression care unit. Not during COVID. They do allow 2 people on triage. During COVID, it's only 1. They don't really recommend early discharge. Sometimes there can be a long wait for triage. Very few of the doctors have a Brooklyn office. Most of them are in the city, but the actual hospital is pretty close proximity to Crown Heights. It's a baby-friendly hospital. There's very limited Medicaid providers there. There's only 2 or 3 providers that take Medicaid at the whole hospital. Most of the providers there do not. There is no midwife option at NYU. And the NICU is what's called a regional perinatal center. It gives that exclusive baby care, that specialized baby care that I was talking about. Doulas are allowed in with a certification. They ask the doulas there to sign in, and one support person during COVID is allowed with the doula at this moment. Again, that could change anytime. NYU Brooklyn and NYU Winthrop are pretty, two like NYU sister hospitals, pretty similar in a lot of the things that they offer. So we'll start with NYU Brooklyn. They do have an early discharge option. The triage seems to be a very short wait. They were allowing 2 people in triage before COVID. Now they are only allowing 1. There's a lot of doctors that have a Brooklyn office. They're baby-friendly hospital, lots of midwife options there, Medicaid providers. It's a level 2 NICU. But knowing that they do, because they're a sister hospital to NYU, if there's any babies that need a higher level NICU, they transfer them to the NYU in the city. So they have that option. They have a C-section rate of about 33%. So it's still pretty low. During COVID, they allow doulas in with certification, one support person allowed in triage, and one support person besides doula allowed in the birth. NYU Winthrop has a lot of MFM care. MFM stands for maternal fetal medicine, which is basically for women who are extremely high risk, women who need extra care during their pregnancy, whether they are diabetic or have bleeding issues or anything else that's going on. They do have that care there, as well as NYU in the city. One of the disadvantages of NYU Winthrop is that there is no doctor's office local. It's a good 45-minute drive, if not more, from Crown Heights. There's a great group of doctors who work there that a lot of people like. There are midwife options in the hospital if you want that. There's limited Medicaid providers. There are some, but they are limited. It does have a regional perinatal center, that higher level NICU we were discussing. At the moment, their C-section rate is a little bit higher than the other centers. It's a little over 41%. But I know that recently there's a firm doctor that moved his practice there, and he's really working to bring that down, which is really, really, really great. They do allow doulas in during COVID with certification, one support person allowed in triage, and one support person allowed besides the doula. A lot of people go there because they feel like it's NYU care, but it's not NYU the city. And again, the disadvantage is that it's not so close.
There was a question.
Yeah.
Does one person in triage mean aside from the mom?
Yeah.
Okay.
One support person. Yeah.
And the next question is, you mentioned before that there are certain things a woman can take with her to the hospital to make her feel homey. What are some ideas?
It's on the list. There's a whole list there. I'm going to go back to that list. Somebody asked about what one can take with them to the hospital. And this is the list I was talking about. I didn't read through the list, but pillows from home, any soft fuzzy blankets from home, anything that will make you feel homey. You know, I've seen people bring candles and lights and things like that. And then the rest of the stuff on this list are more practical things, but those are the types of things that you want to bring from home. The one thing that I see people bring the most are pillows and their soft lights, candles, not real candles, but like flickering candles. They don't let you light candles in the hospital. At home that you can, but the fake candles, and anything else that you want, you're really allowed to bring, as long as it's not anything that's like danger. There is so much to talk about when it comes to birth. We could talk about this for 20 hours. There's so much, and also we're running through this super quickly, doing the best we can with what we have. And, also focusing on this topic. And the other thing is that Michal, if anybody wants to reach out to me on a personal basis to try to find a doctor or a hospital, I'm always available to talk to people. Okay, these two hospitals are North Shore and LIJ. They're both in Long Island. North Shore has a lot of firm doctor options. There's maternal fetal medicine care. They used to allow 2 people in triage before COVID. Early discharge is not really an option. They do discourage it, but there is a very short triage wait. There is no local doctor's office. It's also pretty far from Crown Heights. It's a baby-friendly hospital, but there are no midwives there. And they are very limited Medicaid providers. There might even only be 1 or 2, at this moment. It is a regional perinatal center for the baby, and their C-section rate is at almost 39%. So it's up there. LIJ, the biggest draw to LIJ at the moment is that they have private rooms. So a lot of the women feel like they're literally going to a hotel once they have a baby. There's only 1 person allowed in triage, always been that way. No early discharge. There's a very long wait in triage. I've had people wait there hours and hours and hours. Seems like the hospital has become very popular over the last couple of years, and people are flocking there to deliver there, and it's making the backlog very high. There isn't a local doctor. It's not so close to Crown Heights. It's baby friendly. There are no midwife options. almost no Medicaid providers, maybe only 2 or 3 in the whole hospital. But it is a NICU, regional perinatal center. Their C-section rate is a little bit over 33%. Doulas are allowed with a certification, 1 support person allowed in triage, and 1 support person allowed besides doula in labor and delivery. Again, it's a fancy hospital. It's really, really, really beautiful, but nothing, stands out about it so much at the moment. Okay. What were the other 2? Oh, Mount Sinai, sorry. Okay. Cornell and Columbia are part of the NYP system. There's a lot of MFM care, both of them. They have top-rated NICUs, especially Columbia. Columbia is one of the most specialized baby care hospitals actually in the country. There's some, doctors that are there that, people fly from all over the United States to get care for their babies. So Columbia is the type of hospital that people really go to mainly for baby care. As a matter of fact, the labor and delivery is in the children's hospital. They have a whole hospital that's just a children's hospital, and the labor and delivery is on the 10th floor of that hospital, and the rest of the hospital is a children's hospital. They are very, very specialized. There's some machinery and some procedures that they do there that are not done anywhere else in New York, New Jersey area. Some people between here and say CHOP is the next center that people will go to for specialized care over there. So it's really one of the for babies, we go there very often. But otherwise, it's there's 1 person allowed in triage. The other person has to wait downstairs on the ground floor. They don't even let you up on the labor and delivery floor. But triage is usually short. There's no local doctors. The doctors are all in the city. Very much resident run. There are no Medicaid options. If you want to go through Medicaid, you have to go through their clinic, which is basically run through residents, and then the doctors supervise. But again, as I said, most people go there for the specialized baby care, not for the specialized OB care. And they have a C-section rate of just over 38%. Doulas are allowed with certification, 1 support person allowed in triage and afterwards. While Cornell is there's 1 support person allowed in triage. There's no early discharges, no local doctor's offices, but it's got that specialized NICU and that specialized MFM care, maternal fetal medicine. The C-section rate is a little bit lower than Columbia. The one thing that they really do work well with is with Methodist Brooklyn. Methodist Hospital was taken over by NYP, which is a sister hospital for Columbia and Cornell. So if any babies in Methodist need that specialized care, they're going to Cornell. They're being taken care of there, and they're working very closely with them. But otherwise, their regulations are pretty much the same. Mount Sinai and Mount Sinai West. So Mount Sinai is in the city, about around 100th Street. They have a lot of maternal fetal medicine care, the specialized care for mom. They don't generally encourage early discharge. There are no doctors that are local, but it is a baby-friendly hospital. There are no midwives on staff, and there are no Medicaid doctors. If you want Medicaid, if you are on Medicaid and you want to go to Sinai, the same with Mount Sinai West is you have to go through their clinic, which is again resident-led with doctors following. Again, some people go there for the care. It is a regional perinatal center. They have a C-section rate of just over 32%, which is lower than some of the other centers. So that's why some people choose to go there. Mount Sinai West is pretty much the same. There's only 1 person allowed in triage. It's a little bit closer than Mount Sinai. It's on 50th and 10th. But there are no Medicaid providers. You have to have private insurance to go there, and otherwise you can go through the clinic. The one big difference between Mount Sinai West and Mount Sinai is that Mount Sinai West does have midwives. They actually used to have a birthing center in the hospital that closed down, and it's very, very sad. It was one of the last in-hospital birthing centers that closed down in New York City. The sister birthing center to Brooklyn Birthing Center, which recently opened, is quite close to there. The one very big difference with Mount Sinai versus any of the other hospitals at the moment with COVID is doulas need certification, but they are testing everybody. So in all the hospitals at the moment, when you get admitted, a patient, the mom gets tested for COVID, and in the Sinai hospitals, the doula and the dad get tested as well. It's a requirement. The other thing that they are doing is if you have an induction, which we didn't really discuss, but an induction is, most people go into labor naturally, but sometimes either people need to be what's called induced for medical purposes, or they don't go into labor and they go past their due date, very past their due date, and the doctors choose to induce them for the health of the baby. So when that happens, it's kind of an appointment. Your doctor will tell you at your visit, we need to be induced, and so please come to the hospital tomorrow night, or, in 2 days from now, or whatever it is. So with COVID, the one big difference that Mount Sinai is doing is that if you are being induced, you have to go 24 hours before to get your COVID test. Doula, dad, and mom have to go 24 hours before, otherwise they will not let you into the hospital. They are making it a little bit harder than some of the other centers.
There's a question. What does baby friendly mean?
Baby friendly is a term that the hospitals are using where they do a lot of support to encourage bonding between baby and mom. So that starts from right away from when baby's born. Instead of cutting the cord right away, leaving the cord attached from placenta and baby, putting baby directly on mom's chest as soon as the baby's born, not cutting the cord and putting the baby in the warmer, leaving baby on mom for a full hour before removing the baby from mom to do any kind of shots or anything that's needed, and encouraging and giving a lot of support for breastfeeding. There's pictures and posters in the hospitals on every wall on how to breastfeed. Everybody's taking all these new classes to help moms breastfeed. There's a lot more support on being baby, not as in like, okay, here's the baby, now we got to do this, we got to do that, we got to do this. It's more about supporting that bonding, that time between mom and baby.
And there's another, does a midwife need to also take a COVID test?
A midwife? Midwives work for the hospital, so they generally don't need to. It's their place of work. They're considered a healthcare worker, and they don't generally need to take a COVID test. The doulas are only required to take the COVID test at the Sinai hospitals currently. Again, with all the COVID regulations, also because we're seeing a spike in New York City at the moment, with all the COVID regulations, things could change in 3 days. Things could be different.
That's good. Questions?
That's pretty much it. Okay. The next thing I'm going to touch on is home births. I just want to see what my next slide was. 1 second. Okay. So this article, I can send it to you afterwards. There's an article here that I put up. It's a study, but it highlights the effectiveness and the evidence of having a mother-friendly or baby-friendly childbirth. Just to give you an example of the COVID regulations that are going on in the hospitals, I put these 2 slides in. This was, as you can see, this was dated 11/25/2020, and these were guidelines for visitation. And it says very clearly, like, one support person may be permitted to L&D if patient requires prolonged monitoring and if social distancing can be maintained. They have rules and regulations. One support person and or doula. They must stay in the room. You're not allowed to take a walk down the hallway, go to the vending machine and buy a can of soda. They're not letting patients walk around to the Bikur Cholim room. They're really being very, very, very strict. So just for example, this was on 11/25/2020. And then on December 15th, the Department of Health put this out, telling hospitals that they do not need to ask doulas for any type of certification, whatever, at all. And they are recommending that hospitals do not do that. They were calling it, the words that they used were over here. They were saying, requiring doulas present certification in order to accompany a client during birth is an example of undue burden to doulas and their clients.
Wow.
So this was, we're in the doula world, we're really hoping that the hospitals will take this recommendation from the Department of Health under serious consideration. We're waiting for it to become an official executive order from the governor, so that we can take away all these rules and regulations. But at the end of the day, when you arrive at labor and delivery and the charge nurse or the person who lets you into labor and delivery says to you, you don't have the right paperwork, you can't stay here, you have to deal with it at that moment, no matter what the executive order is. But this was kind of sent out December 15th. It got a lot of traction yesterday and today. So we're kind of hoping that within the next few days, this is going to become an executive order, and these rules and regulations of doulas having to have certification and requirements won't be needed, and that if a woman wants to take her mother with her to her birth, she could do that again, which hasn't been able to happen in the last few months.
Someone asked if you could please show the mother-friendly slide once again.
I can send it out to you. I can send it to Michal, and she can send it out to everybody.
Yes, everyone can
but if anybody wants to like take a screenshot or something, there it is.
And then in the meantime, someone's asking, what are some, other than comfort things? Oh, well, other than comfort things, what are some practical things that someone might need to pack? I guess you can also send out that list. That's not
yeah, I could send out that list. That whole list that's on that slide there is very good. I can even send my personal list that I send to clients. The one thing that you want to know about packing for a hospital, technically you don't need anything. Technically you can arrive at a hospital with your cell phone and nothing else, and the hospital will provide everything for you that you need while you're there, from a toothbrush to a gown to shoes to socks, whatever you need while you're there. Obviously it's much more comfortable if you have things that make you feel more comfortable, that are your own, that are more homey there. And then the things that you want, like the hospital's not going to provide a charger for your cell phone. The hospital is not going to provide any of the Jewish items, whether it's a shir hamalos for the baby or a tichel or a pushka. Those things are not going to be there. And then there's some things that are just practical. I have a doula client who does not like the toilet paper in the hospital, and she brings her own roll. That's important to her. So that's important to her. You know, there's different things that are important to different people, and it's your birth, it's your experience, and it's not about somebody else or what somebody else wants. It's about what's important to you.
Beautiful. Someone asked about your organization. What does it provide? How does it work?
Birth Doulas. So Birth Doulas International, you're more than welcome to look at the site. It's birthdoulas.international.org. I basically started it during COVID, when the governor kind of made this executive order that patients had to choose between doula and spouse. And then when they finally allowed doula and spouse allowed, a lot of people take their husband and their mother and a doula, or their husband and their mother to a birth, but mothers were not allowed, or sisters or friends or neighbors were not allowed to come to the birth. Unfortunately, we're living in a world where it should be a woman's choice. If she wants to have the whole village present when she has a baby, let her have the whole village. If she wants to have her 10 sisters there, let her have her 10 sisters. It's about her. It's about her birth. But unfortunately, we're living in COVID times and things are limited. So most of the biggest certifying agency for doulas is something called DONA. There's CBI, there's Ancient Song, there's a few different ones out there. And I decided that it was time to start one that was a little bit more practical. So Birth Doulas International is a certifying doula organization that does doula training and certifying, so that you can get your certification to go into the hospital with somebody. So we had a lot of mothers who have, you know, birthed their own 10 or 12 kids and then gone with 10 or 12 of their daughters and daughter-in-laws, or, you know, nieces and nephews. I have one woman who took the course who has done over 60 births just alone with her children and her nieces and nephews. And she doesn't have an official doula certification because she took the training, but she never got certified. So Birth Doulas International is an organization that helps women get a doula certification. It trains them. There's a lot of support. There's a lot of help through the process to be able to get to the births, to be there with your, either as a business or as for your loved ones.
Is there anything else you think people know?
No, I think the only thing that I want to touch on is the home birth, different from. So the last thing that I wanted to touch on was the difference between a home birth and a hospital birth. And I don't remember who was the person who asked the question. And if I'm not answering it in totality, please let me know. But there are some people who want to birth at home, and some people want to birth in the hospital, and some people only one home, and some people only one hospital. It's everybody's preference. The biggest difference that I see is that people are much calmer, more supported at home. When you're in your own environment, when you're in your own space, people feel safer. Especially in today's age, when in a post-COVID world, people are scared of going to the hospital. I'm not going to lie. It's not a safe, people don't feel safe. People don't feel safe going there. But at the same time, some people need to give birth there. So there are some people who choose hospital birth, and there are some people who choose home birth. Home birth, practically, it's a lot easier. You don't have to go anywhere. You don't have to schlep everything with you to the hospital. You don't have to schlep everything home from the hospital. You don't have to worry about the car seat. You don't have to worry about the supplies. You don't have to worry about the Uber or the taxi or how you're getting there. You're home and you stay home. Some challenges that come up with a home birth are childcare. Some people don't want their other children around when they're giving birth. Some people do, but some people don't. And if you're the person who doesn't want your other children around when you're giving birth, and we're living in a New York City tiny 1-bedroom apartment or 2-bedroom apartment, it's difficult. Those are challenges. Some women, when they go to the hospital, they choose to go to the hospital because they need that separation from the family. They need those 2 days to recover from birth without 4 kids around them. Some people want to be surrounded by their children. It's not about right or wrong. It's about a preference that a woman has for her birth. I hope that answers all of your questions. Are there any other questions? I didn't really touch on providers.
Yeah, I have a question.
Yeah.
I wanted to know, this course that you mentioned, would it be helpful for the one giving birth to take that course as well? Would it educate and empower?
It's not really, there's a lot of information there on what to do and how to support somebody through labor, but it's all about the support end, not so much about what's happening to your body. It's not so much about the pregnancy. It's about what to do, how to take care of yourself as a doula, how to provide for your client, how to write up a contract, how to do a prenatal, those kinds of things. Do you know what I mean? There is a lot of information about labor and birth and things to do during labor. So yeah, anybody could take it, but do you want to take the course? You could, but some of it is really about how to provide for your clients.
So would there be a course that you would or a course or something else that you would recommend to prepare for your own birth?
Childbirth classes. I highly, highly recommend that everybody take childbirth classes. We're very lucky in our community. First of all, in general, being part of the Frum community, we're automatically networked. We have people all over that are there to help us and support us. And whatever you want to do, there's somebody who does it. So, for example, in our community, we have people who do hypno babies. Sarah Eichler, I think I see you on there. Sarah Eichler teaches hypno babies.
We have on our YouTube channel. She spoke for us last year. You could search her for her talk. She's great.
Sarah actually teaches hypno babies, which is a method of childbirth education classes. It's a specific method that she teaches that women have a lot of success with preparing for their birth. There is something called hypnobirthing there's a woman, Sarah Kramer, who teaches hypnobirthing. There is a woman by the name of Miriam Izagwi. She's actually a labor and delivery nurse in Methodist Hospital who teaches childbirth classes. There's a lot of different options. There are even online options, but there is nothing like going to a class where you have a teacher that you can ask questions to, or being in a group with 2 or 3 other people or 5 other people to hear other people's questions, to hear what other people are thinking, something either that you would never have thought of to ask. At the end of the day, knowledge is power, and you do want to educate yourself. And remember this, taking childbirth classes with your first baby really prepares you for all your future babies. Mm-hmm. It's super important. Invest that time and that effort into it. Very often I see women who don't take childbirth classes, and I don't feel like they're prepared for childbirth. The women who take childbirth classes know what to expect, are more prepared, they know the terminology, they're better equipped to make decisions in the moment. It's super, super important. There's women in Borough Park who give childbirth classes. I'm happy to give you a list, but it is really, really, really important. I know for my own personal clients, when I've seen people get to like towards the end of labor and they haven't taken any classes, like I'll sit down and I'll give them a class because I want people to be educated. It helps us make better decisions, and it prepares us better.
Can I add to
Sure.
the slide you had earlier about fear, tension, right?
Yeah.
So a lot of that can be prevented if we know what's happening. We're not onto the spiral of, there we go, fear, tension, and pain. And it helps us to know what's happening to our body, what are we expecting, what should we know. All of that is very, very helpful.
Right. Very often I have people who call me and they're like, Irit, I'm not interested in taking childbirth classes. I have no time. I have no patience. I'm not really like, what would be the two like pieces of advice that you would give me, or three pieces of advice you would give me before going into labor? So my first piece of advice is get educated. So especially in today's world, if you can't take a class in person, take a class on Zoom. At least then you can hear what other people have to say. You can get educated. And I know for a fact, even somebody like Sarah Eichler, who teaches hypnobabies, is available afterwards. You have somebody to turn to when you have a question. I've seen my clients call their hypnobirthing teacher or their Lamaze teacher with a question, or ask or quote them during labor. Oh, this teacher said this, or this teacher said I should do this. Is it okay if we can do this? That's what it's all about, especially in our community where we're like from women. It kind of takes the village. We take care of each other. We're there for each other. The other thing that I always say when it comes to birth, especially with the first baby, is the two things that you want to do to help yourself the most are A, stay home as long as possible if you're not staying home for your birth. So if you're going to stay home, have a home birth, that's one thing. But if you're going to the hospital, you still want to try to stay home as long as possible. Staying home as long as possible creates less intervention, less time for you to be kind of on a clock in labor at the hospital, and will ultimately be better for you. And the third thing is make water your best friend, whether it's the shower or the tub or whatever you have. Water is hugely helpful for you in labor. So those are super important things.
What are some what are some, why would we want to prevent interventions?
Okay. So
and how does that
it's kind of what's called a ripple effect. Okay, so you have to look at each stage. So if a labor is going smoothly, meaning the patient is progressing, labor is getting stronger, baby's doing well, and everything's going okay, and you don't need any intervention, that's an ideal situation. But sometimes if you do go to the hospital, like for example, if your water breaks and you go to the hospital, they kind of put you on a clock. There's this like kind of 24-hour clock kind of hanging over your head that they want labor to be super active by that point, because they're worried about infection. They're worried about mom getting a fever. They're worried about baby getting a fever, which is all problems. Now, we don't want mom to get a fever. We don't want baby to get a fever, because that could be dangerous for mom. That could be dangerous for baby. And I'm not saying that it's safe to stay home with a fever either. If you have a fever in your home, you need to contact your provider. I'm not saying that at all. But if you're able to stay home and they're not looking, you're not on a clock, they're not looking to intervene, then there's kind of like the less ripple effect. Also, what ends up happening at the hospital is like once you get there and you're on a clock and you're not making change, they're going to want to see some sort of progression. So you're 5 centimeters, and then 5 hours later, you're still 5 centimeters, and 5 hours later, you're still 5 centimeters. The doctor's going to say to you, well, I want to break your water, or I want you to get an epidural, and some people will say, okay, I'm done. I can't do this anymore. I'm tired. I want my epidural. Thank you. And some people are like, no, I want to be left alone. But if you're in the hospital, then you kind of have to deal with that. Again, I'm not talking about in such situations where you need to be there for your care or the baby's care. There was just a situation today. It wasn't my patient. It was another doula who called me. I've actually never seen anything like this before, but she was at the hospital with her mom. They were laboring from early morning, like maybe 4 or 5 o'clock in the morning. And at about 5 o'clock in the afternoon, the patient was 5 centimeters. She had been that way since like 7 in the morning. And the doctor turned to her and said to her, do you want to go home? And she was like, what? Is that even an option? She's like, well, you don't want me to break your water. You don't want an epidural. You don't want to do this. So do you want to go home? She's like, yeah, I want to go home. And the doctor was like, okay. And the doctor sent her home. And I was like super impressed. Like, here's a woman who, the doctor obviously realized she was not at risk. Her water was not broken. She didn't have a fever. Baby looked good. Mom looked good. And her labor wasn't progressing. And it'll be interesting to see what will happen. Will this woman kind of labor pick up in the middle of the night tonight or tomorrow morning? Or is she going to hang around for another week before she has her baby? We don't know. I'm not talking about situations where the mom or baby needs care. If somebody is preeclamptic, which is a condition that sometimes happens at the end of labor where you get high blood pressure, and high blood pressure and protein in your urine. Unfortunately, we're actually seeing a lot of it during COVID. There is a correlation between the preeclampsia and COVID. So we are seeing a lot of it at the moment. It is a real danger to mom and baby. I've seen women who are not pre-eclamptic anymore, who are eclamptic, and it's very scary. We don't want that. We don't want that. You have to kind of weigh your options. You know, I would much rather somebody have, ultimately, if a woman's choice is to have a natural vaginal delivery, we want to support her through that. But if that's not her option, and her option is an epidural versus a C-section, I'd much rather she have an epidural than have a C-section. And that's where education comes into play. That's where childbirth classes come into play. That's where mentors like birthing coaches and doulas come into play, so that you can get the support and knowledge when you need it and have that information at hand. If your doctor walks into the room and says, I want to give you Pitocin, and you already know what Pitocin means, and you know what that is, and you know what it affects, and you know what it does, versus never hearing it before, you're a much more educated consumer if you know that. And again, that's where education comes into play.
Beautiful. There was a question about, as a doula, do you recommend or share any type of ruchnius support?
So everybody's a little bit different. When I personally, when I meet with my clients, it's something that I discuss with them. And some people want it, some people don't want it. And if people do want it, I do give them some things. Even on my packing list that I give to my moms, I have a section called Jewish stuff. So I divide it by like category, like toiletries, technical stuff, Jewish items. So I do, but not everybody does. And, you know, some people are more spiritual than others, and some people just want practical. Some people want just a simple list of what are the Jewish things they should bring to the hospital. What Prakim of Tehillim was one supposed to say? What Jewish books could one read? There's all those options. And then some people are like, no, I have my mashpia for this. I have my mother for this. I'm looking to you for something else. That's a client preference. Hi, Sarah. See you joined.
She just sent.
Okay.
Create a team for your birth. Care provider, doula, birth class, informed husband is so important. So something
yes.
for you to share.
Thank you, Sarah, for sharing this. Creating a team between your birth provider, doula, birth class, and informed husband is so important. You bring everybody together, only the patient will benefit, and only the baby will benefit, and everybody all around will have a better experience.
Is there a class for doulas or mothers connected to Tara that you know of?
Is there a class for doulas and mothers connected?
Or meaning, as a doula, any of the classes that you're giving, does it also bring in some sort of Tara perspective?
The Birth Doulas International is an organization that is for all doulas. It's not only for Jewish doulas, so it's not something that we do in that class. No.
And do you know of any classes for moms? For moms?
For mothers?
Yes. We did the doulas, but not for moms.
For moms connected to Torah.
Yeah, or maybe the provider will share some.
I believe that one of the color teachers have been giving something. There were definitely some educational classes connected to Torah and different things. I would check mikvah.org's website for that.
Mm-hmm. And then for the person who asked the difference between COVID guidelines for Methodist and Mount Sinai, you can personal message me. I'll share my number on here, and then I'll share.
Yeah, you can share the handout.
Yes, exactly.
The last thing I just want to touch on, which we didn't really touch on, is that I always say this: there is no one doctor, one midwife, one provider for everybody. Everybody needs something different. So I'm going to list a few of the things that come into play
when looking for a doctor and a provider. And then you have to kind of run through that and see what's your preference, what's best for you. So A, if you want a home birth or a hospital birth. B, if you want a midwife or you want a doctor. Proximity to your doctor is important for some people. Some people want an office that is located close by that they can pop into in the middle of their workday. And for some people, it doesn't matter to go to the city. For some people, having the hospital close by is important, either out of convenience or necessity, where some people have shorter births and can't travel an hour to a hospital. Some people want sole providers or sole practitioners, which is getting rarer and rarer these days, where there's only one doctor. So every time you go to your appointment, you see the same doctor. The advantage of that is that you get to know the doctor pretty well. Besides his week or two vacation a year, he'll probably be there to deliver your baby. The downside to that is that there are some days he will be very, very tired. And you will probably have a lot of rescheduled doctor appointments because he's running to and from the office to the hospital to deliver babies. Whereas with a group, you have the doctor who's in the hospital and you have the doctor who is seeing patients at the office. So you don't get that. And then there's groups that have 3 or 4 providers, and then there's groups that have 10 providers. You might be somebody who wants to choose a group that has 3 or 4 providers, so you get to know all of them, versus a group that has 10 providers. But you might want to get a group where you have 10 providers and then you get to know everybody. Everybody's a little bit different, but these are some of the things to consider. Don't forget that it's okay to ask these questions to your provider.
Yes.
Don't forget that it's okay to kind of interview your provider to see if they are the right match for you. Bring up a list of questions and concerns and scenarios to your provider. The most important thing during labor is for you to feel safe and supported with your care, whether it's your provider, your doula, whoever is there. It is so important. We don't want anything to create any extra tension or fear during this time, because you really need to be able to let go and relax for labor to happen on its own. So those are some recommendations. And if anybody is looking for a provider or trying to make a decision about which hospital provider, you can get my number from Michal. I'm happy to spend some time on the phone with you to help you narrow down the options that are out there.